Hello and welcome to Canvas, the Niger-Delta Roundtable, where I discuss the future of this region humongously blessed with hydrocarbon resources. Now, every week we give time to reflecting on topics relevant to the development of the Niger-Delta and her people. Now, this episode is no different. I'm here once again as we focus on how to take the region to a more promising future. Now, this podcast is sponsored by the operator of the NNPC SPDC Total Energies Achieve Joint Venture, the Shell Petroleum Development Company of Nigeria Limited, headquartered in Port Harcourt. Thank you for joining. I am Adedayo Ilushakin. Our topic for this episode is Healthy Beginnings, Hopeful Futures. It's a day to reflect on the progress we've made, the challenges we face, and the steps we can take to ensure a healthier future for everyone. In today's episode, we'll be discussing the significance of early health interventions, the role of community support, and the impact of health policies on our lives. We'll hear from an health expert in his own right, a community leader who has experienced firsthand the transformative power of healthy beginnings, from prenatal care and childhood nutrition to mental health and preventive measures. Will cover a wide range of topics that contribute to building a hopeful future. So whether you're a healthy professional, a concerned parent, or simply someone who cares about the well-being of others, this episode is for you. Now, grab whatever it is you need to grab, and let's explore how healthy beginnings can lead to hopeful futures. Again, the topic for this edition of Canvas is Healthy Beginnings, Hopeful Futures. And my guest is Dr. Golden Owonda. Now, Dr. Golden Owonda is an associate professor of public medicine at the Rivers State University. Dr. Owonda is a consultant public health physician and infectious disease control specialist. He has been involved in the containment of several outbreaks in the state, River State, including Ebola, dengue, Lassa, mpox, measles, cholera, and very recently, a sustained response to the COVID-19 pandemic. He is currently the director of the Institute of Infectious Diseases Research and Development at the River State University Teaching Hospital, RSUS. Dr. Golden Owonda, welcome to Canvas and Niger-Delta Roundtable.
Thank you. I'm delighted to be here.
It is a pleasure to have you here. And just before we started recording, we had a conversation, and I remember that I'd spoken with you previously while I was on radio, and you gave some clarity to that. It may have been as far back as 2013. That's at least 10 years ago.
Sure.
That's remarkable.
Right.
And I'm sure in all of that time, or I know in all of that time, you brought your wealth of experience to improving quality of health delivery in River State, and I dare say as well, even saving a lot of lives, because it is renowned, that we did remarkable work, especially as far as managing the COVID-19 pandemic in River State. And it's heartwarming to know that especially you were at the forefront of the great work we did in containing COVID-19 and managing it in River State. So on behalf of everyone who was scared during that time, who had to deal with the situation, the pressure and stress that we were all under, and even those who may have lost loved ones during that period as well, I say a big thank you to you for the great work you and the rest of your team did to keep us all safe.
Thank you so much. And just to say that it was collaborative, team spirit, dedication from everybody that got us that far.
Thank you, sir.
Right.
We're recording this about a week from now, or next week from today, thereabouts, is World Health Day.
Yeah, April 7th.
Absolutely. And the theme for this year, Healthy Beginnings, helping to guarantee future, some future living, future life, and all of that. Early intervention. Why is it crucial to long-term healthcare or long-term well-being or how crucial is it to long-term well-being?
Just like in engineering, the building, the foundation is very important. So you also understand that we need to lay a better foundation for the future. I just draw your attention to understand the landscape for World Health Day and some of the themes that you see. Once you have that perspective very clear, you see some of the advantages of the themes and how we proceed around them. You know that the World Health Day is actually set aside to create awareness and do some evaluation on the general health well-being of the people of the planet Earth. This began sometime in April 5th, April 7th, a long time ago when the WHO was formed. WHO was actually formed as a consequence of trying to conquer diseases, ensure that the communities in the globe are safe. This came after some period of sanitary awakening, where we understood that it was important to be very clean, decent, have neat environment, but we couldn't conquer governance. Because if you do not have governance structures, you will not be able to achieve health for everybody. So after that, the League of Nations, United Nations, and then eventually the Constitution of WHO was enacted. And that was in April 7th. And that led to remembering it every year in what we call the World Health Day. In the last five years, we've had several themes, basically reflective of things we need to do, where we are, and where we want to get to. So, for instance, in 2020, I think we discussed nurses because it was great importance to the health workforce. We moved from that to equity in 2021. In 2022, we talked about our planet because planet, you saw what happened during the suit era. We moved to equity, we moved to universal healthcare, we moved to health for all, and now we're talking about healthy beginnings. So you see that all of them are reflective of where we want to be in the future. What is very important is if you also realize that in forming the WHO, you ask yourself if you were formed by nations, why is it not called International Health Organization, since it's across nations? The term world, using it to say it's a World Health Organization, is describing communities within the world. It cuts across political divides. It talks about the health of everybody. And it talks about in times like this, we remember this is where we are and this is what we want to achieve. Looking at it critically, you will come to see that maternal mortalities and neonatal mortalities are a critical area for us. We have nearly 300,000 maternal deaths every year, 2 million neonatal deaths. Maternal mortality in this part of the world especially is at the roof. So when you look at all this, it is important to set standards. What are the things that we can do to keep our children safe? What are the things that we can do to keep our mothers safe? And mental health seems to be a part of all this. So this is why we say that it is important for everybody to learn how to have a healthy foundation for our children especially, so that the future can be brighter for all of us.
A recurring theme for this episode would be early health interventions.
Sure.
or programs.
Yeah.
So can you give an example or examples of early health programs anywhere, but maybe especially in our climate,
Yeah.
and the kind of impact that they have had on health generally?
Early health interventions are there are a lot of them. But for this scenario that we're discussing heavily antenatal care. A lot of people say prenatal care, but prenatal is a bit broad. Prenatal will basically discuss even before you get pregnant, trying to make sure that you're in the best state of care, health before you even get pregnant. Antenatal basically period of pregnancy, the care that a woman deserves to ensure that she has a healthy baby and she's healthy at the end of the delivery. So ANC has had a great impact in the lives of our mothers. In fact, ANC can reduce maternal mortality by a very great percentage, and we've seen this happen. because ANC has the capacity to offer preventive services, screening services, immunization services, counseling services, educational services. So you have a healthy mother and a healthy baby at the end of it all.
So, does this in any way tie into immunization? Does it? Is
Yeah,
there a correlation between this and immunization?
a lot of it, both for the mother and the baby pair. For the mother, I'll give you a very clear instance. It's tetanus. When I was a young medical student, this is real life stories. We go to wards to see pregnant women or women who had had complications during delivery brought to teaching hospitals. One of the cases that we see is tetanus among the young child. Basically because pattern of delivery have been complicated by sepsis, very unhygienic places where these women deliver, and the children, the cord can be cut with all types of sharp objects. They pick them on the floor, they cut the cord, they return them to the floor. All this happens. And this causes tetanus in the newborn. Now, if you go to our hospitals and take a census, they're very rare today. And the reason is because the mother is immunized against tetanus in ANC. And so the mother passes the antibody to the newborn, and the newborn does not have the chance of developing tetanus, irrespective of pattern of birth. So this has great advantages for us. And you go to our hospitals, you see that the cases we're seeing, we've conquered most of them, especially the ones that follow the routine advice that we give.
Now, you went over the last couple of years, the last few years, and the themes that have formed World Health Day.
Yeah,
And for you, those themes are not happenstance;
sure.
they are strategic.
Yeah.
Now, while researching for this episode and this recording, I also discovered that the World Immunization Day or Week or something of that nature is not far off from World Health Day. Is that also strategic?
Yes, World Immunization Day may be not one of the very great World Health Days that we observe, but it's very important for us, especially in Sub-Saharan Africa. In Sub-Saharan Africa, immunization coverage is still below what is expected to have herd immunity. So we still push the frontier using these opportunities for World Health Day to do some of the things that I'm doing with you now, which is create partnership, sensitization, advocacy, create awareness so that people can take responsibility for their health. Because this is bedrock. Government had a responsibility in one aspect, but we also have a responsibility to take care of our health. So
we'll come to our own responsibility in a moment in this discourse. But what are some of the key components of effective prenatal care?
Just like I said to you, the first is that you need to register early. Early registration at the right place. You see, a lot of people are doing antenatal registrations at the wrong places. I mean, if you want to register, it has to be in a clinic. It has to be in a facility that is accredited by government because they have met the standard of care. There's something called the standard of care. And this is a certificate that is issued to all clinics. So the clinic that you want to register your wife or your sister or whoever for antenatal, that clinic must have the standard certificate for care.
Prenatal, I think.
Yes. Okay. It must have the standards. So if it doesn't have it, you can't. So the first thing, like I said to you, is that the woman must have registered early for this service. The second is that there are immunization services that are accruable to pregnant women. During the course of ANC, these women must receive them. The third is early screening for diseases. A lot of screening happens for women. And I give you one clear instance is HIV. Like they used to say, HIV does not show in the face. I'm sure you heard this often. So you can have a pregnant woman who is infected with the virus, but does not know. Now, the scenario is very interesting because if you place her on drugs, she's going to live a normal life. Additionally, she will not have the capacity to transfer the virus to the unborn child. Interestingly, she will also not have the capacity to transfer the virus to her husband, assuming that is a discordant case. So there is great advantage in having screening services, sometimes not just for HIV, sometimes for blood sugar, because if you don't have your blood sugar is deranged, you have difficulties with delivery of the baby. Baby can become too big to pass through the passage. And there are a whole lot of other screening, including anthropometric screening. If you do anthropometric screening, you will be able to categorize pregnancies in expectation of the mode of delivery. So at antenatal care, a good obstetrician can tell you ahead of time that this pregnancy is very likely to be delivered through a cesarean section. That allows you to prepare. Unlike a woman who had not done ANC, this woman will walk right into the cesarean section without the resources to have safe delivery. So these are some of the tenets. There are also curative services, like simple malaria. You see pregnant women infested with malaria. Malaria causes low birth weight in children, parasitizes the placenta, can cause abruption, can cause problems with the placenta, and you will find that delivery will be complicated. The child will be low birth weight, the child will have difficulties in survival, neonatal mortalities will be very high. So all these are some of the, opportunities we have when we go for ANC. And there's a very interesting part of it. ANC allows us to categorize pregnancies, especially the ability to identify pregnancies that are so said to be high risk. And then you offer interventions that will ensure that the mother-baby pair is safe at delivery. So it's a great package, and we encourage everybody to be part of it.
So as far as healthy beginnings are concerned, are you saying that prenatal and antenatal care can't not be offered, or at least effectively, in every health facility? Because especially in our climate, you have a sizable number of persons who would rather access their health care via private health facilities rather than state-owned facilities. So are you suggesting or saying explicitly that not all health facilities, especially private ones, can offer this care?
Oh, there are a lot of private health facilities with good capacity for ANC. As a matter of fact, in some of developed societies, private hospitals are the basis for rendering services to the people. However, in developing society, it needs to be a partnership, a two-way system where the public provides the services and the private provides the services. What is important is that the standard of care must be certain. And there is a directorate of government that is responsible for ensuring that if Dio wants to open a hospital, if Dio wants to open a facility, it is able to meet that standard of care. What is necessary, which includes the manpower that you have, so you don't run quacks, you don't put quacks in the hospital, put a signpost and get our people to go register and have maternal mortalities. So we want to be sure, the government wants to be sure that you have good manpower, you have good infrastructure, you have good equipments, and the services are tailor-made to meet what the people needs. Once that is seen, you are given a certificate of standard, which enables you to render the service, public and private.
You mentioned developing countries.
Sure.
Ours, to a large degree, or by every standard or yardstick for that matter, is a developing state or country. And there are several others like it. Poverty levels in developing countries like ours are extremely high. What can parents do in the Niger-Delta or in the broader Nigerian space to ensure at the early stage that their children have adequate requisite nutrition and access to health care, especially considering these, militating conditions?
In terms of nutrition, beginning early. In terms of nutrition, the advocacy is for breastfeeding. Breastfeeding is the basis. Breastfeeding has a lot of advantages. Breastfeeding is the bedrock of stability. I tell you that the breast milk is basically the child's first vaccine. Breastfeeding has benefits for the mother. Breastfeeding has benefits for the baby. It is safe. It is easy to digest. It carries all the nutrients. It is tailor-made. And people say God has made it specifically for the baby. And we advocate that you must do this exclusively, at least 1 hour, at least within the hour of birth, for 6 months, exclusively. No water, no abo, no oranges, no fruit juice, just breast milk. And you will see how healthy the baby has come to develop. First of all, it will help the baby develop brain systems stronger than others. And what is very important, especially in our environment today, is the ability to foster a safe social environment, which is called mother and child bonding. So the mother is able to say to the child, stop, and it stops. And these are some of the things that people will say, those children that were trained with cow milk those days in the early 70s are the ones that are causing all the troubles in the society. Well, I don't know this, I'm just saying. But what is important is that breast milk is the bedrock of nutrition for the child. And it has to be exclusive for the first year, for the first 6 months. After 6 months, you do complementary feeding. And complementary feeding is not like you have to go and buy cabbages or something. It has to be what you eat at home. High protein diet, low salt, low sugar, stay away from food fats, So, and then you must breastfeed for 2 years. This is the way we advocate it, And you don't have to go to you don't have to. It saves you a lot of resources. If a child is being breastfed and it's not being breastfed, and you have to buy the baby milk, it's pretty expensive, and it takes a lot out of the resources of the family.
In more recent times, mental health has come to the fore, if you will. Well, I imagine that it has been a matter of concern for health professionals like yourself
Yeah.
for as long as one can remember. But in more recent times, even complete neophytes, as far as healthcare is concerned, now I've heard one or two things about mental health. What role does that play in the early stages, and how crucial is it to pay attention to that?
Yeah, like I said, creating a safe environment for the child is very important for the development of mental health. WHO has said that for you to be healthy, for Dio to be healthy, it should not be because Dio is not sick. It must be because you have a complete mental, physical, social well-being. So what is mental well-being? Mental well-being describes a state of balance between you and your environment. Some people say it is a positive equipoise, an utopian scenario in which things are great, you're happy, you can achieve in society, you can reach your potential. So to some extent, it's an utopian equipoise. It is a dynamic status. But we must encourage everybody to have the ability to cope with stress, to have the ability to reach their capabilities, to have the ability to achieve their dreams, to have the ability to survive in a social environment. If you stay quietly without friends, you probably go into depression. So you should have such a network that offers you a safe environment. And the home is the first of it. So beginning early, having to nurture your children, having to train them in a way they should grow up, offering them opportunity to discuss with you, offering them opportunity to seek for help when they want it, offering them education. This builds up their mental health. So apparently, mental health was actually relegated in the background in the last few years. I mean, we had operated with the Mental Health Act of 1800s, which was called the lunacy law or something. It was enacted sometime in 1915, reviewed in 1954, I think. And it was not until 2021 that Nigeria repealed and enacted a more recent law, which seems to encompass some of these things we're saying, because we have to be holistically well, healthy, as it were, as WHO has said. As a matter of fact, I am not certain if our penal code still does not criminalize suicide. Suicide is a very poor mental health state, which you can get from a lot of diseases like the chronic diseases, diabetes, HIV. Some of these things can give you depression. And if you have depression, you can go to suicide. And if you have suicide, criminal code, you go to jail. So it's as much as saying if you have malaria, you go to jail. So we need to rework some of these things, not just at home, but also by policies, by advocacy, to ensure that it is more encompassing, creating an environment where everybody is safe and healthy.
Let's bring it closer home,
Right.
Doc, if you will.
Yeah.
Still on the matter of mental health.
Yeah, sure.
So for that family that's living in Diop or some other part of Port Harcourt or River State, that's known more for its notoriety than anything else, you know. And the norm is that things go south, that
Yeah.
bad things is what's expected. I mean, how the parents who live there, largely because of their economic status or situation, how do they guarantee or how can they help assure the mental health of their newborn or their young child in such environments?
It's a tough call. I won't say it's not. It is a tough call. But we must understand there are basic ingredients in the social environment that help us achieve good mental health. For instance, is a justice system. You must have good justice system. The community must have, or the people must have opportunities for conflict resolution. People must have opportunities that will allow them to discuss their challenges, cope with stress. And African societies are probably great, in some of these aspects. So it's not. There is no society, there's no part of the world that is immune from mental health. But within our societies, there are certain social ingredients that we need to make available. We should open up doors for conversations. We should open up doors to have social linkages or social net breakers, so that fall breakers, so that when once people have challenges in reaching their potential, they can look back home and have an opportunity for strength.
You talked about net breakers.
Yeah,
Let's talk from the community perspective.
yeah,
What are some of these, to borrow expression again, net breakers that the
Yeah.
community itself can put in place to foster healthy beginnings?
Oh, well, for instance, you're a young person. You started a business. It's not working great. There are village meetings where you can actually go get some loans, rebuild your business, and cope with the pressure and the stress. Assuming you didn't have it, you have challenges with coping with the mental pressure. So these are some of the things. Sometimes people go home and just talk to people. You have opportunity of sitting face to face with your mom or your dad and discuss a scenario. It alleviates the pressure. It opens up room for building your mental health to be resilient to stress. So these are some of the things that helps in that kind of environment.
This Canvas Niger-Delta Roundtable in commemoration of World Health Day, we're discussing a very important matter that has to do with healthy beginnings. My guest is Dr. Golden Owanda. We'll go for a break. We'll return shortly. Conversation will continue. Please stay with us.
Our yellow and black markers indicate pipeline and flow line right-of-way boundaries. Your activity could impact on the buried high-pressure hydrocarbon pipelines and flow lines, leading to possible leaks and explosion. Please keep off. Do not engage in sand mining or any form of excavation, pipeline vandalism, oil theft, and bush burning within pipeline and flow line right-of-way. Do not farm, trade, or locate any business on pipeline and flow line right-of-way. It is against the law to apportion land, sell, or build on pipeline and flow line right-of-way. Maintain a setback distance of at least 30 meters or about 100 feet from the right-of-way boundaries always. We care for your safety and that of the environment.
This message is brought to you by the Shell Petroleum Development Company of Nigeria Limited, SPDC, operator of the Nigerian National Petroleum Company, NNPC Limited, Total Energies, and Ajib Joint Venture.
Welcome back. Still Canvas in Niger-Delta Roundtable brought to you by SPDC. I'm Dio. My guest is Dr. Golden Owanda. It's wonderful to have you here once again.
Thank you, Dio.
In commemoration of World Health Day, this year we're discussing healthy beginnings, hopeful futures. And thank you for joining again. Health policies.
Sure.
I imagine, as with policies that affect other aspects of human endeavor, are quite critical.
Yeah.
Uh, what roles do they play in promoting or shaping um, hopeful futures, healthy beginnings, and hopeful futures?
Sure. I told you earlier that the World Health Days give us opportunity for reflection. Gives us a lot of opportunity for reflections. And if you reflect back, you will see that the jump in life expectancy actually happened before the advent in technological developments. If you dissect that a bit, yeah, if you dissect that a bit, you will see that there were actually early experiments in things like sanitary conditions, improvement in environmental conditions. I give you a classical instance: is some public health laws that were done around sanitation, keep your environments clean. Those led to improvements and containment of common diseases which were ravaging the populations, like cholera. Cholera in the early times could as much as kill 60 people in a day in times of John Snow. Before it became expedient to say there is an interesting,
Jon Snow?
yeah, John Snow experiments. I could tell you that story another day.
Okay, please.
Yeah. John Snow, apparently, he told them that cholera, basically, about 18th centuries, he told them that it was related to the pollution of water. And they didn't believe that much, So he went to the tap that was supplying water that was polluted, and removed and stole it away, as the myth will have it, or the story will have it at that time. And the cholera stopped. So he was able to prove that drinking water has to be potable. Otherwise, people fall ill and die. So I'm just trying to draw your attention to what policies can do. So we can fast forward to the future. To now, present, and then the future. Have you noticed that 80% of lung cancers are related to smoking? That if 10 people have lung cancer, 8 of them are smokers. What if you put a policy that nobody should smoke? Which very restrictive anyway. But don't smoke in public places. You will reduce the prevalence and incidence of lung cancer. So policies play a great role in, ensuring that we are healthy people. You also see that in immunization. There are policies on immunization, on childhood immunization, that has reduced diarrheal diseases among our children. And when you reduce that, you see that life expectancy will also increase. So all these policies are very important in championing or pointing a direction in which health-related health behavior should follow. And this helps us to live healthier lives. This guarantees the future and makes it brighter for everybody. So health policies are very important. But health policies must be based on science. And once they are, we have a better chance of survival.
Did I hear you right?
Yeah.
Or did you say earlier that life expectancy, there's a correlation between that and even technological advancements?
It has been said that the greatest achievement in life expectancy happened before the advance of modern medicine. Modern medicine has a heavy curative aspect, heavy development in curative medicine. So it's in literature that the improvements in life expectancy happened especially within the period of preventive medicine, where we were more concerned with our environment. But it's broader now. We can't just do environment alone. What we understand is that even health alone, which is why we moved from the Millennium Development Goals to Sustainable Development Goals. Millennium Development Goals was that let me even give you the history. First, we believed that we had to do health for all. Everybody should be healthy. So how do we achieve it? We say, let's do primary health care, especially for developing society. A vehicle that will make everybody healthy. We found that eventually we need to go a step further. We moved to universal health coverage, which is affordability. So don't go to hospital with money, do a health insurance, that will help us. And then we went to Millennium Development Goals and said, okay, let's do this and this and this. If we're able to do it by 2015, we will say that we have health for all. And eventually we couldn't achieve it because we realized that health doesn't have to be about health alone. And that led to the Sustainable Development Goals. So achieving health is a complex factor. It's a complex organization. So we're looking at poverty, we're looking at our environment, we're looking at our climate, we're looking at safety. I mean, if you had money, you have all the health centers, you had a clean environment, and there is war, you can be healthy. You can't even guarantee life in a short while. So poverty, peace, climate, environment, health, core health issues in Israel, which is SDG 3, all these are components that can guarantee health for all.
Can individuals play roles in the formulation and implementation of these health policies, which, as you've explained, have enormous consequence?
Yes. SDG, the last SDG, which is SDG 17, I think, is partnership. We've realized that for us to achieve better health, hopeful future, we must partner. Today I'm partnering with the media. I'm here to talk about things that can help us reach a lot of people. You have to partner with private sector. You have to partner with the environment. You have to partner with agriculture. This is the One Health scenario. If you do not have a One Health scenario, you probably won't have a healthy future, because a greater deal of the viruses that had troubled us are from animals. They're crossover events. Ebola, Lassa, COVID, monkeypox. Crossover events. They're from animals to man. Man can contain them. They become an epidemic. They have a passport. They become a pandemic. So we must partner with agriculture. Veterinary services must be part of the work in health. The environment is very important, because when we had soot in rivers, you know how it was, isn't it? So we must have policies. No more flaring. Make our people safe. Because if you're flaring, if we have a lot of flares, for instance, we have a lot of artisanal refining, illegal artisanal refining, for that matter, you have a lot of soot. You have a lot of soot. And a lot of soot in an environment is passive smoking. It's secondhand smoking. And secondhand smoking has deleterious health effects.
You talked about how life expectancy was a lot higher in an era of preventive medicine.
Sure.
So, as far as preventive measures go, what steps or preventive measures can we take to improve our quality of life?
Preventive medicine is a broader aspect. When people say preventive medicine, especially in public health, is pretty broad. So they're in layers. So if I wanted to prevent development of a risk factor, that would be primordial prevention in a society in which it had not arisen. So if I go to a community in a rural area and I iodize their salt, for instance, they are not at risk. I iodize their salt, have a policy that salt should be iodized. You probably won't see goiter in that community. That's primordial. There's primary prevention where, the risk factors are there. But I'm ensuring that the risk factors do not lead you to development of disease. So you work in an office, you have a sedentary lifestyle. Please start exercising. Please do exercises 150 hours a week. Primary prevention. You can stay away from hypertension. Secondary prevention. Somebody has malaria, you have to treat it. If you do not treat it, malaria, as simple as it is, has capacity to cause cause anemia, cerebral malaria, or even affect the kidneys. So treatment has become a form of secondary prevention. Tertiary prevention, somebody is probably had an accident, his limbs have been amputated, you need to provide a prosthesis. That is rehabilitation. It's tertiary prevention, so that the person can live a normal life. So prevention cuts across. It's in layers, So to answer your questions a little bit more socially, there are things that we do that help prevention. Some of them are ensure that children get vaccines when they need them, ensure that the girl child is educated. Everybody is educated, but girl children, very important for the family. Ensure that people get educated. We do a lot of advocacy campaigns, do a lot of sensitizations. All these are opportunities that we can use, as preventive measures to ensure that we have a hopeful future.
Is early health intervention all that it is made out to be? I mean, do we have examples where early health intervention literally changed the course of a person's life, especially health-wise, or a scenario when a person were normally predisposed to a certain condition, but early intervention changed the course of that?
Okay. I'll give you a very extreme example and a simple intervention. So we'll start with a simple intervention. I have a friend, his blood sugar has gone beyond normal, he's diabetic, and just by altering his food, his diet, blood sugar had returned to normal. Preventive service.
So he's no longer diabetic?
Well, I don't want to put it in that form. I just say his blood sugar is under control.
Okay.
Now, because diabetes is a chronic disease. If you take your hands off the pedal, you'll probably be back with the scenario. That is a simple condition. There are extreme conditions. The artist, one of the Hollywood artists, who's had a family history of breast cancer, and
Female?
and had to take off
Angelina Jolie?
Yeah, something like that, and then had to take off the breast. Prevention before risk factors become apparent, and she can have it. She's prevented it. So these are extreme conditions where people have taken extreme conditions to secure their health and ensure that they are healthy and they have a hopeful future. You see this? So, like I said, they are in layers. Very simplistic ones, more technical ones. But what is important for all of us is screening and health check. It's advocated that from time to time you do the screening that is necessary for your age. If you're a young person, young people have to do screening for their eyes so that they can go to school and catch up. For active people, you have to check your blood pressure, you have to check your blood sugar, because half the time you spend all the time in the office, you're eating a lot of food fats. You don't know the cause of death for your parents. So, you have to be sure that your genes are okay. For very elderly people, you have to look at your prostate. So all these are in layers. And every health facility can offer you that opportunity to have a screening and have a healthy future.
Quite remarkably, I must say, because just a couple of days ago, I remember having a conversation with some person, and the Angelina Jolie situation came up.
Yeah.
Quite remarkably, I must say, because that conversation is in no way connected to this episode we're recording right now, the podcast.
Right.
And I mentioned, because I had known about this,
Sure.
and I had mentioned it to the person,
Yeah.
and the person had never heard about it. He was thrilled. But then again, was that a wise choice? Because at the time Angelina Jolie performed that procedure, removing her breast to prevent breast cancer, she did not have breast cancer.
Right.
But however, her mom had breast cancer, so it was in the genes, I guess.
Sure, sure.
So maybe there was a predisposition.
Right.
But she did not have it.
Yeah.
Was it a wise step to have taken?
I don't want to be judgmental, but I'd say there are options. That was extreme.
Okay.
That was an extreme choice. But she didn't want to take chances. Some people can be stuck with, some emotional challenges, and they don't want to take chances. So they can see this type of stuff arise, and they don't want to see a breast lump. It's going to scare the hell out of them. So take the chance of having an extreme measure. But breast cancer prevention, breast self-exam is a critical first step, to preventing. Before you can do routine mammograms, probably yearly. If you have a breast lump, you take it off, and basically you're safe.
You've described earlier, you described different stages
Yeah, right.
as far as global health expectations or even efforts are concerned. At the time, we wanted everybody to be healthy.
Yes.
At the time, we realized, okay, maybe that's not possible. How about accessibility and affordability?
Sure.
And then, other things have happened, Millennium Development Goals, Sustainable Goals, all of that. What are your hopes for the future of global health? And especially, here in Nigeria, a developing country, and even more specifically, the Niger-Delta?
Sure. I mean, globally, my hope is to have a renaissance of the essence of World Health Organization. I'm basically heartbroken that United States pulled out of WHO. But we look forward to a time when they come back to roundtable and talk about the challenges, because it has to be global. It has to be global. Poor health anywhere is poor health everywhere. We've had diseases cross over from one part of the world to another part and become a pandemic. So we can't afford to walk in silos. We need to all be together on the table and talk about the future. In terms of Africa, Africa is now having a double burden of disease. Africa and Nigeria, which Niger-Delta are basically part of where we are. We're having a double burden of disease, but Western countries, they are worried about non-communicable diseases, obesity, hypertension, diabetes, cancers. But for us, we used to worry about infectious diseases because of the environment we find ourselves. Unfortunately, some of those diseases that they suffer because of development, we are now suffering them. We spend more time by eating food fats. Our jobs are white-collar jobs, exercises. We moved from offices. We're driven by our drivers. We go home. The pressure to come back to work. No time for exercise. No time to have even a great meal. So we're seeing a lot more non-communicable diseases. So we have a double burden of disease. Just being in Africa offers you opportunity to have your own share of infectious disease. And then because of the type of lifestyle we're living today, we also have non-communicable disease. So we look forward to a scenario where we can fight both. Luckily, Nigeria is organizing itself, to ensure that we can face up to non-communicable diseases. Back in the Niger-Delta, communicable diseases are a challenge. And that's why we started the institute in River State University Teaching Hospital, which I'm director. And one of the things we wanted to do was to build competency. We want to build competency because the capability for intervention is probably the height of it. As far as infrastructure is concerned, it's persuasion. You persuade government, they provide infrastructure. What if they provide and we don't have the capability? So we're building competency-based skills for healthcare workers to be able to see patients and render the services that they need.
What are our exposure or risk levels like, especially here in the Niger-Delta, with the superpower, the US, pulling out of the WHO? I imagine this also means that funding for certain healthcare services worldwide, including here in Nigeria and the Niger-Delta, have been pulled as well. What does that mean for us?
For me, it's a wake-up call for African governments, especially in terms of HIV funding for Nigeria, South Africa, which probably bears a huge burden of the disease. So it's a wake-up call. But if you look at the recent UNAIDS description, they say that we're at a crossroads. We're at a crossroads because we had a trajectory in which people who were living with the virus have become plateaued, which means the world is doing well in terms of controlling HIV. The world is doing well in terms of conquering polio. The world has done well in terms of conquering COVID. The other diseases that have been put in check. Together, in partnership, the world was able to conquer smallpox and put it in check, even though some societies have not destroyed their stock of it. But whatever it is, it's eradicated to a great extent. So I think that it's a wake-up call for Africa. We should take the lead. Because if this happens today, maybe you resolve it tomorrow. There's no guarantee that it won't happen the next day.
How can we all contribute? I mean, this generation or the current generations have the challenges that we are living with. But there are coming generations. There are future, even unborn generations. What can we do to ensure that they have healthy beginnings and hopeful futures?
I mean, we can put it in strata. Individually, we owe ourselves responsibility to be healthy. So you have to do all the behavior that is necessary to keep yourself healthy. Collectively, we will need to work in partnership with everybody. Like I said, individually, you have to look at things like ensure you and your child or your wife, are up to date with immunization. You take your diet in response to healthy living, a lot of grains, the low fat, high protein, low salt diet, low sugar diet. You stay away from added sugar as much as possible. So collectively, we also owe ourselves a responsibility to invest in health. And especially government. Government must invest in the health of their people. Because a scenario where I still use the instances of some diseases like HIV or even COVID or, well, let's not call names, but some diseases, the drugs that your people are using are fully funded by the foreign countries. Is a security risk for your people. So governments must commit resources to ensuring that the people are safe by doing what they have to. And not dependent on external force. Thank you.
Thank you, sir. And that's a wrap for this episode of Canvas in Niger-Delta Roundtable. We've discussed healthy beginnings, hopeful futures, in commemoration of this year's World Health Day. My guest has been Dr. Golden Owanda. It's been absolutely brilliant having this conversation with you. Thank you so much for your time.
Thank you, Dara. It's a pleasure to be here.
And thank you for the great work that you and the rest of your team, I know you said it's collaborative, we identify that, the work that you're doing to ensure that the rest of us can sleep safe and live healthy now, have healthy beginnings, and even have a hopeful future as well.
Thank you. Thank you, Dara.
Thank you once again for joining us for this edition of Canvas in Niger-Delta Roundtable, brought to you by SPDC. Catch this and other episodes, and new ones also on our usual platforms. Do have yourselves a wonderful rest of the day.